for Kenyan to pay 100 shilling is better than to try and cheat us that you can be able to, to access free healthcare without paying anything.
We are losing 122,000 babies, children under 5 every year. If that's not a disaster for you, I don't know what is.
How do we deal with the costs of healthcare?
Every Kenyan must have an access of a health facility within a 5-mile radius,
such that there has to be a major referral system in every county government.
We have all the elements of a good political story. We have politicians, we have journalists, we have evidence, we have data, we have a lot of background work having been done and research having been done, and we've really seen how storytelling and journalism has changed in the past 5 years. What we hope to do today is to ensure that it changes in an even different way, to bring it to an even deeper dimension of what a journalist as a watchdog is actually about. But let's first hear what it is that a small sample of the population of Kenya says that they want when it comes to their health.
Nifanyie matibabu ya bure.
Wakati tunapo safiri kwenda ng'ambo, tunatumia pesa. Na hizo pesa tungekuwa na vifaa ambazo zingekuwa katika nchi yetu, tungekuwa tunasaidika sana.
Either there are no medicines or there are no doctors who are attending them, and because of all these problems, I think they should be able to do something about it.
The new government have to come with a system of facilitating the hospitals that we do have in this nation.
Right now it's about 2 o'clock. Go to Kenyatta, it will take you maybe another 8 hours to be admitted. 10 o'clock you'll be admitted, after 10 o'clock. Go now, you'll be admitted after 10 o'clock. How much serious you are? That's the, it's in a pathetic situation. You cannot believe it.
So let's go to what happened during the presidential debate. So as you can see on the site, you click on the first photograph below the video, and we're calling it Promises.
Professor James Ole Kiapi, who is the presidential candidate for Restore and Build Kenya, promised to increase the number of health workers and improve their terms of service. The other promise is relocate doctors from tertiary to primary health facilities, and also to ensure that there is less dependence on donors for funding of HIV/AIDS programs. Mohamed Abduba Dida of Alliance for Real Change gave Kenyans the promise of preventive medicine. Eat when you are hungry, one third food, 1/3 water, to keep the doctor away.
The CORD Coalition, the summary of their promises is to establish a national health insurance scheme so that everyone has a right to health, train more doctors and improve their terms of service, renovate health facilities, invest in specialized services like treatment of cancer at different levels. And for Jubilee, free primary health care for all Kenyans, increase health financing to 15%, guarantee fully equipped health centers within 5 kilometers from every family, improve pay packages for doctors and other practitioners.
When they say they will increase the health budget from 6% to 15% to match their Abuja declaration, how soon will they do this? Where will the money come from? They need to be more specific about some of these issues they are laying out.
On the concern about population, we are saying we'll give mothers free access to health delivery and everything. Vis-a-vis, we are trying to control population. How are those two going to balance?
According to you, what is the role of communication and the media in terms of making healthcare plans achievable?
There is an ingredient missing, and that ingredient, that verb, is checking. Is checking the how. If you say you will do this, how will you do it? To get to the evidence-based storytelling we're talking about.
When you talk about healthcare, whether it's preventive or whether it's treatment, you have to go down and become very granular. we have statistics on health spending per capita, per county. And you can take that data and ask, and look at that data and look at it and say, this is the spending per capita, and then what are the diseases in this county, and what are the diseases in this other county, and what is required. You've heard about doctors' flight. Somebody gave us very good data, I think one of the journalists here. How many doctors are leaving? How many doctors are we producing? What kind of doctors are we producing? How many health facilities do we have? It's all available. How many do we need from now? How many do we need every year? How much do they cost to actually build?
Many of the things Mr. Kukubo mentioned are available for you to look at. And I'm going to go to the first slide, which talks about, we talked about the brain drain, we talked about doctors leaving the country. There's a slide here which we're calling Fixing the Doctors Shortage. What we realized when looking at the slide is that it would cost approximately 4.2 million Kenyan shillings what it would cost to train the number of doctors that Kenya really needs according to WHO standards. In Kenya at the moment, 360 doctors graduate every year from Kenyan universities. So if we were to imagine that all these doctors that we need to appoint to get to WHO levels had to be appointed in Kenya, it would actually take us 21 years to have that number of doctors if the level of training remained the same. We're not saying it's going to take 21 years. Maybe somebody is saying we need to double the number of doctors being trained. Imagine the budget implication of that if double the number of doctors have to be trained. If you look at the number of doctors per 100,000 population, the deficit is 7,708 doctors. The cost of training one doctor is 4.2 million Kenyan shillings. Look what it would cost to train this number. Do you remember that during the presidential debate on the 11th of February, it was stated that cancer is now a bigger killer than HIV, right? Go to the data. Somebody said, but we said at the beginning of the session, when somebody says, you need to check. What we have in order to be able to check, like Gigi has outlined, is the data. The top 6 killers doesn't even include cancer. Maybe there's a perception because of the 2 ministers. Maybe there's a perception because ARVs, of course, have made a huge difference so that there are far fewer deaths that are HIV related. Maybe we've gotten used to HIV, but HIV is still the top killer. And then we go to the others, and number 6 is malaria. So the data tells us, helps us to tell a credible story.
For the public health sector to work, you need 3 key issues that need to be addressed. The 3 key issues are the human resource, train, not only train, but remunerate well and retain. There is no need of training 1,000 or 2,000 or 10,000 doctors, and 8,000 go to the US and you remain with 2,000. It doesn't help. The other thing is infrastructure. The ministry has what they call norms and standards. For each facility, there are certain things it must have. If it's a dispensary, it must have a certain number of equipment, it must have a certain number of personnel, it must have a certain number of drugs. These norms and standards, are they going to be implemented properly, or we will just keep on hearing we will train more and more people?
How do we deal with the costs of healthcare? If you forced every member of parliament to spend the CDF on clean water in every constituency, you reduce a huge amount of diseases that bring burden to curative measures. If we looked at preventative measures first, then we make the savings, then we move to stage 2, where we are now looking at other issues. Because the problem is not what we're trying to solve, or what the manifestos are trying to solve. The curative measures, everybody would have free healthcare. The problem in this country is poverty. So we must bring research, combine with these numbers, define the problem, and begin to sort out the problem.
How quickly does data transit from classified government information to public data?
Most of the data that you see from the Ministry of Planning has to go through what they call curation before they give it to you. because it is very critical they do that such that you don't use it and then later on they tell you those who are not the numbers.
There have been serious data raised here. There have been serious issues raised here that are missing in your various manifestos. Are you admitting that are you going to change? What are you going to do differently, perhaps from all the three of you?
Number one, it involves stopping the corruption, even in implementing all those kind of. And that's why we believe as RBK, what we need in Kenya is a change of the personalities in terms of governance and of this nation.
For us, we are talking about promoting primary healthcare practices like breastfeeding, like oral rehydration. Going back to the basics, each person must be must access an amount of water that is not less than 35 liters per day, and therefore, starting from there, then we are going to work together with the county government to advise them on how to supply piped water that is equal to the needs.
How many Kenyans have running water in their neighborhoods? And how much we spend or misspend in the health sector? The figures are there. Dissect them. Look at how much was spent on each county, how much was spent on what disease, how much was spent in prevention, how much is spent in cure, how much was spent in administration, and then benchmark that against other countries, because that data is there. Journalists and political parties must be able to also infer from data that is not directly related to the subject they're talking about. So you can infer from, say, education data, what you should do about the healthcare sector.
Telling journalists to be reading all those manifestos which are written the same thing, it would be very difficult. It would make a very boring story. The experts have given you the data, they've told you this is the problem, and now you have to go to the next level and say, innovatively, so what am I going to do? Because of the whole thing, you have the data, and the data tells you these are the problems, and then what are you going to do about the problem? And that is a story one would want to run with. And that is why you, as a journalist, as an individual, you look also different. So you journalists, you have to look for a way of bringing something different. And the data give you something different.
How do journalists survive in this scenario where politics is given priority, whether it's important to the country or not? It's very difficult, even in our editorial meetings, to convince the editors that your science or health stories could actually make the headline.
To an extent, I mean, Gigi will agree, it's give and take. Newspapers give because Kenyans want politics. But now they have the ability to demand a new kind of political story. This is a political story. Gigi's story of today is a political story. This discourse that we are talking about will help us create a demand from our editors and from our listeners and viewers as journalists for a kind of story that actually doesn't just repeat what somebody else said without checking, and therefore creating a really, really, really powerful counter voice, not for the sake of opposition, for the sake of factual, credible journalism.
The conversation that we are having here has really created a buzz on Twitter, and I'll just read a few. Mostly I'm seeing people are reacting to some of the things that Dr. Bitange Ndemo spoke about, and also some of the statistics that my brother Kukubo gave. If we'd started these conversations in 1963, we would be a developed country. That's, I think, a tweet from what Dr. Ndemo had said. Kenyatta is a referral hospital. It's not for treating diarrhea. You should not walk to Kenyatta Hospital without a referral. It's not a center to treat minor diseases, from what Dr. Mohammed said. And then, of course, quite a reaction to some of the things that have come up in this conversation, because some people are asking, I thought cancer had joined the top 5 list. So I think the information that is coming out of here is really enlightening people so that some of these misconceptions are cleared. So those are the tweets.
The proposal by CORD is actually that they're going to impose a compulsory fee on every household to pay for to prepay for their healthcare needs. I think that's what should come out very clearly. While Jubilee is proposing a voluntary system of payment for those who are not able, while taking care of those who are vulnerable, the disabled, the children, and expectant mothers, getting free services in our facilities. So that should come out very clearly. And it should also come out very clearly that actually the system being proposed of the National Social Health Insurance is a noble idea, but actually it's a system that has already been rejected by the workers.
It's not that we are not aware of what is happening with the current national NHIF. We are aware of that. But CORD, and especially the CORD leadership, we are committed to reforming healthcare, and more so in ensuring that the Constitution is implemented. But I also want to challenge you. You're promising to give free healthcare, but you are not telling us where you're going to get this funding. Kenyans are not kids. You will tell them that now you're not going to pay anything. You're going to walk to the hospital and get ABCD. That's really, it's wrong, and it's wrong to lie to Kenyans. So if we say for the sake of having accessibility to healthcare, having facilities, and reducing, mortality rate, for Kenyan to pay 100 shilling is better than to try and cheat us that you can be able to, to access free healthcare without paying anything.
You've already had a discussion going on here. One was the Minister of Finance, the other one of Medical Services. They have both failed, and they're trying to insist that this time it will work. Journalists, please, can we also investigate beyond the figures you're being given, beyond the wish lists we are receiving here?
The private sector is very well developed in Kenya. If you go to Nairobi Hospital, if you go to Aga Khan, it is world class. That is why we all go there. But the public sector, the public health facilities are almost all in very deplorable conditions. And you can correct me if I'm wrong. I read from somewhere that part of the reason is because of regulation and certification, that the government has very stringent measures in terms of allowing private hospitals to operate. There are certain standards they must maintain, otherwise their licenses will be withdrawn and they won't be able to practice. But when it comes to public facilities, because the same government is the one in charge of regulation, they tend to loosen the regulations a bit because it's a government thing. And somebody suggested, if you have government, the one regulating health facilities, then you have a problem. So you need to have an independent regulator who is not controlled or appointed by government regulating both sectors. Is that captured anywhere in your manifestos? Because I think it is key as far as making healthcare standard in Kenya.
This is an issue that is best left to the health experts. The best practice, based on research, is that hospitals have better outcome when people with a health background run them. I think that is what the scientific research as per 2008 has been, and that is what is being relied on in determining who manages our hospitals. It's very important that management skills are imparted on the healthcare workers. It will be a very important component which prepares them for the eventuality that they'll become managers of these facilities, they'll run them properly.
What alternative financing mechanism to healthcare, even if it is to, say, a specific disease, say HIV or cancer, do you have it?
The alternative to government funding is invitation of public investors, private investors. Number two, we have a lot of money in the private, in the public. Even now, if we only stopped two things, wastage and corruption. So from public, it's enough. The question is efficiency. From private, invest and regulate well. It is still good enough.
Starting from the point where we are, we actually have to start with a stimulus investment. It has to be a sacrifice that we decide to make one time, and then make these hospitals attractive. It's only when these hospitals are attractive that we can now talk about inviting other partners to invest, because everyone wants to invest in what appears to hold hope for to become a success story, and therefore you can have Kenyan citizens, basically even who have private insurance, deciding to choose their health providers as public hospitals, and this is going to be another source of funding.
You need to put a stimulus package, then you have to adopt a universal healthcare scheme. That will inject 60 billion every year into healthcare. And the truth is, we always say 15%. We don't need 15%. We need about 9% of our budget going into healthcare, plus health insurance 60 billion. We have a system that works and is moving forward, retaining the people you have and getting more. It's possible, and we can actually achieve that.
There's a model that the experts have already worked on, which can be borrowed across the board. A model which suggests that we invest 217 billion staggered in 3 years in the health sector, and this will actually be able to refurbish all existing hospitals. It will be able to construct the new proposed referral hospitals, and it will be able to employ and retain the staff that are currently serving in the health sector. So if this stimulus package can be the starting point, then we'll make these facilities to be attractive.
We cannot pretend that we can do without donor. We may not be able to deal with the issues of malaria, you know, if we don't have global fund for malaria, if we don't have like PEPFAR, I mean for HIV/AIDS, it's going to be a burden to us. And that's why we still want to seek the private public partnership.
Healthcare has been neglected for a very long time. What is the result? Every single day that we are still saying education, whatnot, we are losing 122,000 babies, children under 5 every year. If that's not a disaster for you, I don't know what is, and you may as well go, you're building schools for children who won't live to see it. 122,000 of them won't see it. Prioritize healthcare. That's what we're saying. Let's stop. We've trained more than 5,000 doctors in the last 10 years, in the last 15 years, but they've left. Is that a problem to you?
As journalists of the next generation, most of you are young people, we must move from the journalism that we don't ask questions. And the only way that will get you out of people trusting that you know what you're talking about is to have your facts right. Data helps you to get the facts, but you also have to be a good storyteller so that data clamped alone will not attract leaders. What I would want you to do is to have a sanctity for data, and the data is there. And people like Internews will be able to help you. They have very good, I'm not doing campaign for them, but they have helped me, because you cannot work on data alone. You need other people to verify for you. Because as I told you, there are data from very many sources. So you just want to get that thread of how they are going. And as I told you, we have space for that kind of stories. Thank you very much.
Thank you, Gigi. Sanctity for data. Yeah, it's as much of a sin to sweep something under the carpet, to underemphasize as it is to overemphasize something and create hype that isn't there. So thank you very much, everyone, for participating in this discourse, for helping us to think about data too and how we can use it more effectively. I hope you will take away from it real examples, real ways in which you can develop many, many different stories. This will not be the last time we talk about this issue. There are very, very many issues that can be explored in a more, through the sanctity of data, if I can put it that way. Thank you. Thank you, everybody.